I'm very excited to be here. It's my first time in Tasmania. And so I'm going to follow up on a thing that both Ralph and Jane mentioned. So I also took that kind of like lesson learned approach that Ralph used. So yeah, I'm going to talk about using remote islands actually as study systems. So it's also linking to what Nick was talking about at the beginning. And in other words, why do we care about penguins where we do One Health? Because they live relatively far away from us. I guess you do coexist with penguins here, but like Antarctic penguins are far away from us. But they're still like very good models to understand some things. So why do we work on islands as study systems? So some of those points are tackled in the paper that Nick mentioned this morning, and that was mentioned already several times. But so from a conceptual point of view, they are a great system for several reasons, starting with the fact that they're very strongly spatially structured. So especially when we look at islands where we have a lot of colonial species, we can really identify each bird on its nest, in its colony, on its island, within an archipelago. And so we have those well-defined discrete units that we can use to then track some specific dynamics at different scales. And so I consider islands as like little petri dishes, or I guess gigantic petri dishes, where we have different conditions that we can sometimes replicate, sometimes not, sometimes we manipulate ourselves. So for instance, we accidentally introduce rodents and then we remove them, not accidentally. And something that we don't control at all. So for instance, a virus reaching one island and not the other. Even though there are discrete units that are well separated from one another, there is some connectivity, as was pointed by Jane. So we have opportunities for like introduction and exchange of pathogens and other things. They also have, when you go to high latitudes, very strong temporal structure. So it's perfect to track what's happening one season and then the following season. We're not in that continuous landscape that can be a bit harder to work with. So for instance, if you've been on a Subantarctic seabird colony in summer, you would have had a very different experience than if you went to that same colony in winter where there might be no birds at all or just a few ones left. They are also relatively simple systems. So any biological system is not simple, but they are relatively simpler than other ones. So we have, especially when we go in high latitudes, relatively few species. They're usually nicely gathered in dense monospecific colonies. Sometimes they do mix with a few of them together. So you can have penguins, cormorants, and albatrosses together, but very often you would just have your albatrosses here and your penguins there. So again, easier to work with. And so finally, I mentioned there's a little bit of connectivity, but they are same like relatively closed systems. So again, very well-defined units. So that's, again, some of the point that was mentioned in Nick's paper. And so concretely, what it means is that we can tackle several of the usual challenges we are working with field data. So it's not perfect, but it's better than other systems. So we have well-defined analytical or experimental units that can be our island or colonies or archipelago. We can use our different islands as special replicates or different seasons as temporal replicates. It's all kind of like defined for us by the way the islands are organized. It can be also easier to have a good population representativity because when we go on an island where we only have 5 species, we can easily like cover all of those species, which can be trickier when you're in like more complex systems with more species coming in and out, for instance. And finally, when you work on seabirds and seals, because they're colonial species, it can be relatively easy to achieve very big sample size if you compare, for instance, to, I don't know, polar bears, where you might, spend a whole PhD to sample like 5 bears. Here you can go in the field and within one day sample tens of birds. So when I say there is big sample size, there is very big sample size. So for instance, here it's a king penguin colony on Rode Archipelago, so in the southern Indian Ocean, where we have several tens of thousands of penguins nicely gathered together on this one spot. So you see they're not mixing much with different species. I don't know if you know your penguins very well, but we have the black and white are the adults and the brown ones are the chicks. So it's all king penguins. Same here with an albatross colony. This one is 200,000 bears, biggest black-balled albatross colony in the world. And so you can see, same thing, everyone is nicely set on their nest, waiting to be sampled. And so we do have penguins in the middle, but not too many. So okay, I'm gonna, now that we've talked about like the concepts, I'm gonna show you how we've been working with that to study bird flu. So Ralph gave you an amazing, basic, like the foundation for bird flu. So I'm gonna, I don't have to explain too much of that, hopefully. But so putting you back in 2023, that was the virus situation. So we had those big outbreaks in Europe in 2022, and then it spread to the Americas, and then southward to South America. And then we started stressing out, is it gonna reach our field site here in the Falkland Islands? And more broadly, like, is it gonna reach Antarctica? And so we had several outstanding questions, even though obviously there's already been, as Ralph mentioned, like decades of studies on bird flu, because that's something that we've always been worried about. Sorry, I don't know why it's going on its own. So some of the key questions we have are, who are the reservoirs for the virus? So what are the species that are maintaining the virus from, for instance, one year to another? So for instance, Ralph mentioned that we have a lot of preconceived ideas about like answers to those questions. So very often you would hear people say, oh, ducks are reservoirs for bird flu. But like they're actually like very good, solid data to show that. What are the small and large scale vectors? So same, like we have some ideas, but it's really hard to know for sure. What is the impact on the virus evolution of those repeated host switch between wildlife and poultry and birds and mammals? Is there any mitigation solution that works? And you can put lots of other questions. And so working in the Falkland Islands, so that island that is just between South America and Antarctica, we were really on the, like, expecting the virus to come. So it's exactly what Worf was defining. We were expecting it to come, it didn't come. And then it came, and then it left. So it was like we were constantly on our toes, trying to see if we could collect some good data without knowing exactly, when it would come and what colony would be it first. So the first thing that was set up in the Falkland Islands, so for the context, the Falkland Islands are the only subantarctic archipelago in which we do have a permanent civilian population. So we do have people living there. They do a lot of sheep farming. So they just have their normal life there. That's like not just scientists going there. Contrary to, for instance, the Antarctic Peninsula, where it's like research and tourism, but no one living there. So the Falkland Island government set up what I will refer to as a community-led surveillance program. So concretely, they were asking people living there or people visiting if you see any unusual thing happening with the birds. So a lot of dead birds or like symptomatic birds with weird symptoms, report to the government. So I'm saying birds for now because originally we were thinking it was only birds, but as Ralph laid out, then it was expanded to other animals too. So this is a passive and opportunistic detection program. So we don't have anyone specifically going somewhere to look for it, but just like anyone who is living their own life and see something can report it. So they set up, a phone number and email address where you could report your cases, did some communication. And so the great thing with that is that contrary to what we can do, there's only that many scientists on Earth. So we can all like work in our specific field site and collect very good data from there. But then there is all those other places where we don't have any data being generated. So by involving the community, we considerably expand the range of that surveillance. And as I was saying, there's a lot of farming there. So mostly sheep farming, but there's also a few cattle. And this is great because farmers have free-ranging sheep on their island. At the beginning of summer, they will herd the sheep to put them in different pastures for shearing or lambing season and so on. So they just go all over the island on their bikes, on their horses, and at the same time, they can check the penguins that are just back from migration. So we have this like network of people who are just like going all over all of those islands and are able to tell us if they see anything unusual. As it was pointed by Ralph, we also have a lot of tourism activities. So the Falklands has a little bit, and then if you go to South Georgia and the Antarctic Peninsula, then it's those crazy high numbers of people going every year that were mentioned. And so same, the IATO, which is the organization that kind of like regulates and coordinates tourism in Antarctica, has set up this pipeline so tourists can talk to their guides who then report suspicious observations. And so same as for the farmers, it's just that those boats are going everywhere all the time. There's a lot of them. So it also expands our range of surveillance. And so as like to show what we could learn from that, so this is a map of the Falkland Islands. And so you can see dots with different colors. So in orange, it's what I call sporadic outbreaks. So it's just like 1 or 2 dead animals. Red, actual outbreaks, where we had evidence of sustained transmission. So usually it's like tens, hundreds, or thousands of dead animals. And so that's a few cases that were reported in 2023 when the virus first reached the Southern Ocean. So we had a few cases here and there, only 3 outbreaks, Sea Lion Island in Gentoo penguins in the south, Carcass Island in Gentoo penguins in the northwest, and then Steeple Jason Island with blackboard albatrosses on the very northwest. I put here the logo of Falklands Conservation to highlight that it was not just farmers who are like reporting cases. We also had those ongoing seabird monitoring programs that were a bit more dedicated to obviously like seabird monitoring, but not necessarily to disease, that allowed us to detect some of those mortality events. Then we had a few cases in winter that were also reported by people. And then summer 2024, 2025, so 1 year later, second year of the outbreak there, we had this like massive widespread episode of just outbreaks popping up everywhere, mostly in Gentoo penguins, and also for the first time in the Falkland Islands in elephant seals. So that was our first mammalian outbreaks. And so you can see that the surveillance is covering like a large part of the islands. So obviously they are, obviously or not, but there are like a lot of penguins here and here too. And we don't know for sure like that they didn't die or they did die, but no one went to check them. So obviously there is still like, it's not perfect data, but definitely more than we could have had explored through our scientific research. And as we are speaking now, we still have Gentoo penguins dying close to Stanley. So Stanley is a little city there. So that's where we have, I would say, the most active surveillance. And so now we know that penguins are dying still in winter, the few penguins that are staying on the islands. So it's very effective for tracking pathogens across large scales, but obviously it's not perfect. So we have a lot of false positives. So people reporting, oh, I saw 1 dead penguin, but there's actually always 1 dead penguin on the colony. So that's not really something worth investigating, although it might be in a few cases, actually, a bird flu case. And also we have a lot of false negative, I call them. I don't know if false negative is the right name, but the thing with that kind of approach is that it only detects clinical and usually lethal infection. So as Ralph mentioned, finding symptomatic birds is very hard. Finding dead birds or dead seals is much easier, but it means you're only finding the ones who died. And as I will show later, they are not all dying. It also comes with social and economical considerations. So when an island would report dead birds, and we would have an investigation to sample the birds. If it's positive, then the island is going to get closed, so no tourists would come anymore to avoid the risk for the people, limit the risk for the people, and also avoid spreading the virus further. So it means when you're an island owner, you might have a lodge where you're welcoming tourists all summer. You see a dead bird and you're like, should I report that bird and take the risk that I'm going to lose all of my income for the summer? Or should I just not say anything? So we don't know for sure that everyone has been reporting everything, but we do know that there are several islands who played along very well. That was strongly helped by the government because they set up some subsidies. So for instance, they would reimburse all of the bookings that were done before the closure, that kind of thing. So you really need like the whole community to be working together. Like the government needs to help. So people feel then encouraged to participate. So that's one of the, I would say, like critical example from last year. I don't know if anyone here has been in the Falkland Islands, but if you've been in the Falkland Islands, you've probably been to Volunteer Point because it's the one king penguin colony in the Falkland Islands. So a lot of people go there, and they had an outbreak in the Gentoo penguin. They were just near the king penguin, so they had to close the site for some time. So a lot of tourists actually like canceled their whole trip to the Falklands because they wanted to see king penguins. They couldn't anymore. So it's like not just that one side, but like the whole economy of the archipelago that is being impacted. So you need ways to encourage people. So as I was mentioning, like limiting the consequences for them. But also we found that one of the best ways to keep them engaged is really when they report something, you need something to happen after. Otherwise they're like, yeah, what's the point? Like we report and then what? And so that's where like the collaboration between the vets in the Falklands who are leading this surveillance program and the researcher teams, including my teams, really helped because the vets don't have the capacity to send someone to investigate all of those outbreaks. But if you take the vets plus the different research teams, then we had the capacity. So when there would be an outbreak detected, then we would send something and sample stuff. So we're moving to step 2 now that we know where there are potential outbreaks. We're trying to understand the transmission dynamics by collecting more data. So here we're moving from that opportunistic passive surveillance system to a systematic, dedicated investigation involving several species. And so it's a mix of visiting affected sites, so triggered by the reports from the community, and unaffected sites as like control. And those are sites that we predefined before at the beginning of each season. So what it looks like, sampling dead seals. So this one is actually from South Georgia, where we also have work happening. And then you assemble your best team for the field to sample the live animals. So again, here we have featuring Clive, our seal wrangler, and Jane as our penguin catcher, and myself as a skua catcher. And we collect samples not only from the dead animals, but also from the live ones. So we can see really who is being impacted, who is being exposed, who might contribute to the spread of the virus. And so that's what islands with outbreaks look like. So to change from the dead seals pictures, now we have dead bird pictures. So you can see here the albatross colony on Steeple Jason, where we have a lot of dead chicks, a lot of empty nests, a lot of feathers. Albatrosses with penguins happily living in the middle. So it looks like there's something already, like some species might be more affected than others, as Ralph was mentioning. And here a Gentoo penguin colony, where the more you look and the more you find dead animals. So as I was mentioning, this approach is like really reactive and proactive at the same time, and it's more systematic. So we sample not only the affected animals, but a bit of everything. So sampling dead and live animals, we use 2 different approaches. So the one that I guess Ralph was referring the most to, which is swabbing the animals to look for the virus by PCR. And then if we have positive samples, sequencing them so we can get information on transmission chains. And on the other hand, we also collected blood so we could look for the immune response of the animals, which informs us on 2 things. The first thing is all the infections that were not lethal. So the birds who got infected developed immunity and survived the infection, which would be completely missed if we looked only at the dead animals. And also we get some information on whether the animals are developing some immunity. So that helps us, I wouldn't say make predictions, but like make some guesses of maybe what could happen in the future. And so I'm gonna start with the immune data, the immunity data, because that's what we analyzed first. So you can leave the discovery experience with me again. So these are the species we know are affected. So we had a few cases in monoclopal penguins and brown skuas. and massive outbreaks in albatrosses, penguins, and seals. But we sampled all of those other species. So we selected them based on the ecological categories they occupy, I would say. So on one hand, we have, so the one that I call mesopredators, they're mostly like fish-eating birds and seals. We have a few ducks and geese in the Falkland Islands, so I put them there too. And then we have at the top of the food chain our scavengers and apex predators, generally speaking. So terrestrial in that case. So for instance, we have the squid that were mentioned several times by Ralph, and other gull and bird of prey species. And so sampling all those animals, what we could learn. So starting with the fact that we actually started sampling before bird flu arrived, and I'm gonna go back to that in a minute. But before bird flu arrived, we had no antibodies against any avian influenza virus in the system. So our system was completely naive, except for the ducks. There had been no mortality events in ducks before, so we suspect this is just a low-pass H5 virus. So Ralph explained a little bit, like it's quite complicated, all those different HPA or avian influenza viruses. Not all of them are HPAI, so we think ducks had their own little thing happening. And then we sampled once the virus reached the island. In our mesopredators, we had big mortality events, again, penguins, albatrosses, yet no one developed immunity. So that tells us that probably if you get exposed, you just die. Striking difference with our apex predators, so skuas, giant petrels, vultures, a lot of them developed immunity, which means a lot of them got exposed, which makes sense because they scavenge on dead stuff, and they developed some immunity and survived the infection. So it means, again, if we only look at the dead things, we are missing all of that. And also importantly, we had some cases in those birds, including on islands with no detected cases. So we can really use them as sentinels. We might have missed a dead seal, but a skua wouldn't have missed a dead seal. So we can use them to track the pathogen this way. And finally, the ducks. So we sampled more species, hence why we have these 3 points. But again, I suspect they are their own thing. And so you can see here, if we didn't have that point here for the ducks, we wouldn't have known, like maybe we would have said, oh, they're all being exposed to. But actually now we're like, okay, maybe they're not exposed, maybe they have their own low path H5. I told you before we can reach good sample size. So this is about 3,000 samples that were collected over about 2 years for 15 species just in the Falkland Islands. And again, I want to point the fact that you really need good baseline data if you want to be able to interpret those data correctly, especially when you work with antibody data, because you cannot say for sure it was HPAI, you just know it's H5. Okay. So now if we add our points from the data we got through our zero surveys on antibody detection, we have more islands where we know that the virus went, even though we didn't detect any cases. And more species too. So a lot of scavengers notably. So now moving to the PCR data, here is a phylogenetic tree of the virus that we could build with all the data we collected from the Falkland Islands, but also other sites, and also by putting our data together with other published data. So I'm gonna take you through it very quickly. In blue, we have the Falkland Islands. So first thing we can say, there were several introductions in the Falkland Islands. You can see one here, one branch here, and one branch here. And we counted that there were at least 7 introductions just in the albatross colony on Steeple Jason. So definitely a lot of connectivity with South America. We also had an independent introduction even in South Georgia the first year. And then we had spread to the Eastern Archipelago. So as Ralph mentioned, the Crozet, Kerguelen, also probably Marion and Gulf, and also to Antarctica from those outbreaks. Now, if you move to the second year, so you move here to 2024, we can see that the new outbreaks are coming from the outbreaks from before. So the virus was actually maintained in the Falkland Islands. So we have overwinter maintenance of the virus there, and then it further spread to more islands. I'm being attacked by a bird. And so again, that was, Ralph mentioned it's very useful to look for carcasses. That was about 130 whole genome sequences we got from dead animals. And also wanted to point that we have a lot of switch between birds and mammals that we haven't fully investigated yet, but we're working on it. And so like the story here, I won't go more through it because Ralph already explained it very well, but we can identify a few key sites. So the Falkland Islands might act as a reservoir because we have this overwinter maintenance. South Georgia seems to be acting as a very efficient hub for the virus to spread through the Southern Ocean. And then we have Rosa and Kerguelen on the colonization front. And luckily, those are places where we do have quite good long-term monitoring. So we hope to carry that on. And okay, now last step in my 30 seconds left. We need to understand, okay, we know what the virus is doing, but how is it doing that? And that's where we need the collaboration, interdisciplinary collaboration aspect that was mentioned several times. So take into account the life history of your birds, who is resident, who is migratory, who is going where. And then you can work with ecologists to include a lot of different data that could be useful to understand the dynamics. So I'm going to focus just on movements, what we could learn from recycling movement data that existed before bird flu reached the islands. Albatrosses affected on steeplechase. They just spent the whole summer doing back and forth between South America and the Falklands. So good candidates to explain the several introductions. Penguins in winter, they molt, they don't have a colony to raise their chicks, so they just move around all over the Falkland Islands. That could really well explain why we had all those outbreaks that started very early everywhere across the Falkland Islands the second year. And then we also collected dedicated movement data. So here we have giant petrels who were suspected to be potential vectors. And look at that, just within a few weeks, they go all over the place after having been fed on a dead penguin in a bird flu outbreak. I want to point that dedicated movement data are way above repurposed movement data for that kind of purposes, even if repurposed data are useful, because often published data were collected from breeding birds. That's usually what most people care about, like impact on fitness and so on. But non-breeding birds have very different behavior, and they can be behaviors that are actually more prone to spread pathogens. So the conclusion, what do we learn? Who are the reservoirs? We think Gen 2 penguins from the phylogenetic data. Who are the vectors? Definitely a lot of different species can be involved, but every species, depending on their behavior, can play different roles. And then we are still looking at the evolution and the potential mitigation solutions. And so where do we go from there? Opportunistic community-led surveillance is very powerful, but it works better if you also complement it with systematic multi-species investigations. So try to sample everything. Baseline data are critical, so start now. Subclinical infections are common and they can play important roles. So for instance, those giant petrels moving everywhere, carrying the virus potentially. So you need to sample like everything, even the things that are not dying. And one of the key things is that wildlife can maintain and spread the pathogen on its own, because we don't have cases in poultry there or in other livestock. I guess I'm going to skip that. The same approach, like why we had good baseline data was because we started studying other diseases before, because there's not only bird flu in those systems. And the samples are very useful for different studies, so you can bank them and use them for the thing. We're gonna carry on our sampling in those areas. We're gonna start looking at the livestock in the Falkland Islands and also setting up similar projects in the US, because as it was mentioned, we have a lot of diversity of bird flu in the US, including in cows. And I think that's my conclusion. Islands are also a beautiful place to work.